why I titled my presentation, COVID-19, an evolving story. So as we all know that our knowledge about this virus, its contagiousness, its spread, the mechanism by which it causes disease, its impact in different populations, its global health impact, all is information that is evolving even in the adult world, but more so in children. And that mainly is because there is a lot of data about children that is missing. In fact, the best available data from CDC is extremely incomplete. And it is incomplete in the following domains: surveillance, testing, symptom severity, frequency of hospitalizations, frequency of ICU admissions, underlying medical conditions, comorbidities, and outcomes. So the story is even more incomplete in children. So let's talk a little bit about the epidemiology and quote unquote known epidemiology. This is from what has been reported, which again, as I said, is incomplete. In the US, about 1 to 5% of diagnosed COVID cases occurred in children, and children constitute about 22% of the US population. As of April 2nd, 2,572 confirmed cases, and of course, many non-confirmed, non-tested cases are present in the US. 90% of these cases were associated with either a household contact or community exposure. Only 10% had a travel history in the family. The median age of these children was 11 years, and about 57% of them were boys. The following is the age distribution of the diagnosed cases of pediatric COVID as reported by the CDC. And you can see the point that is very clear from this slide is that there's really no age that is immune, even within the pediatric age range, but it can also affect children as young as newborns and really young infants. And I think that's the point that I wanted to make by this slide. So what are the clinical characteristics of COVID-19 infection in children? I think we all know by now that in general, from what we understand, children are not affected severely. Most of the children are either asymptomatic or they have mild symptoms. And this table, if you, I'm not sure how nicely it projects, but I have highlighted some key statistics here. And the most common presenting symptoms of COVID in children are fever, cough, and shortness of breath. And in this data from the CDC, about 70% of children had one of these symptoms. But that means 30% did not have any of these, what we consider classic symptoms of COVID. And then the other point that I want to make from this slide is that a good proportion of children, about a quarter, had relatively non-specific symptoms like myalgia, headaches, sore throat, so symptoms that are very much like our common flu, right? So we have to have that index of suspicion, and I think we have it. We are surrounded by COVID right now. And the one other interesting point to make here is that about 13% of patients presented with abdominal symptoms like diarrhea, nausea, vomiting, and abdominal pain. Coming to what is known about treatment of COVID-19 in children. So basically following its clinical course for mild to moderate disease, symptomatic and supportive treatment is what is recommended. And the vast majority of children will get better with the just supportive treatment. The small proportion of severe illness, and the statistics that are known right now is less than 2% of of children who had diagnosed COVID infection required ICU hospitalization, and about 5 to 20%, that's a wider range, were hospitalized for various reasons. So for severe illness, as we know, similar to the adult world, there are only a few choices, and all of them have the investigational drug status right now. And remdesivir is available with approval for compassionate use or in trials. So this is the latest guideline that actually came out just a few days ago from the Pediatric Infectious Disease Society, and talking about the use of antivirals for children with COVID-19. And just highlighting the key points of this study, they described some clinical trials that are ongoing about efficacy trials for remdesivir that are going on, and only one of them is basically in children, and children above the age of 12 years and greater than 40 kilograms with confirmed COVID. And this is for mild and moderate disease. And then there is one for severe disease, which is defined by the need to, need of supplemental oxygen or intubation or respiratory support. Then there are 2 expanded access protocols. And now through the manufacturer of remdesivir, it is available for single patient expanded access for compassionate use. Coming to hydroxychloroquine, and this is definitely a very controversial, this from the beginning of the pandemic has been a very controversial medication, and even more so now with some recent data coming out in adults. Now, as of these guidelines, they did talk about, the pediatric folks talked about this as a second-line agent if remdesivir is contraindicated, not available, or while you're waiting to get it from the manufacturer. And again, they highly recommend that this be used as part of a clinical trial, that these patients are enrolled in some of the clinical trials that I pointed out earlier. They definitely talk about not combining azithromycin with hydroxychloroquine because of the risk of prolonged QT syndrome and ventricular arrhythmias. And as of right now, there are about 15 US trials. Some are pre-post exposure prophylaxis, and only one of them is enrolling children above the age of 12 years, and that's an efficacy trial. Now, this is just hot off the press. I actually was having a conversation earlier today with one of my colleagues who has very close relationships with folks who brought these guidelines out. And I think with the new adult data, coming and the FDA cautionary statement coming, even these folks who brought out these guidelines are nervous about hydroxychloroquine, and they may be revising or adding an addendum to their recently released society guidelines. So just this recent statement that came out from FDA, really guarding against at least community use of hydroxychloroquine and recommending that it be used only under trial conditions. So these are some other investigational therapies in children. As you can see from this slide, from convalescent plasma to IL-6 inhibitors to interferon beta to lopinavir and ritonavir, we really do not have any data in children about any of these medications. So what message does that give us right now? The real message here is we do not have any proven treatments for COVID-19 for the small subset of children who develop severe disease. I believe to date, 3 pediatric deaths from COVID have been reported. The number may have increased, but that's what I remember. Hence, the important message that this slide gives is prevention really by social distancing is our most powerful tool to prevent our children, and through these children, other adults and especially the elderly ones. So we'll shift gears a little bit to some common questions that pediatricians, pediatric providers, or any healthcare provider may be asked by family members, by neighbors, and by your patients who have children at home. So some of the common ones that I have come across, I tried to answer in these next few slides. One relates to pregnant women diagnosed with COVID infection. So can my unborn child get COVID-19 from me? And the answer is it is unlikely. Reason being, in the little data that we have where amniotic fluid, placenta, and other birthing like postpartum materials that have been examined, COVID has not been isolated from that. In fact, what is believed is that there's a higher chance to get this infection postnatally when the baby's in direct contact with the mother rather than intrauterine transmission. So to date, we are not aware of vertical transmission during pregnancy. Next question is, so you have a COVID-19 mother who is really inclined to nurse her baby, breastfeed. So can an affected mother breastfeed her infant? And the answer is yes. However, it comes with some caveats. We really want to promote breastfeeding for its other benefits, including, immunity boosting effects, but preferably in the form of expressed breast milk to reduce that direct contact, that happens during nursing. However, if the mother is absolutely adamant and really wants to do things as naturally as possible, she would really, really have to maintain a lot of protective gear and stringent hand washing and wearing masks, and make every effort to protect the baby. So yes, the answer is yes, but with those caveats. The one that is really, I think, on everyone's radar, including a lot of pediatric providers and many of us who are concerned about the increase in the risk of outbreak of vaccine preventable diseases because of reduced frequency of well-child visits. As we know, because of the lockdown and social distancing rules, a lot of parents and children and grandparents or other caregivers are just very scared to bring these children for well-child visits. And that's the opportunity that we have here to administer routine vaccinations. So we come across this question, can my child get his or her routine vaccines? And so the answer is yes, absolutely, and not that it's a choice, they should. In fact, there was actually a study that was done by an electronic health record company, which collected data from 1,000 independent pediatricians. And it reported that, from February until just the beginning of April, rates of vaccination for MMR had declined by 50%, for DTaP, which is diphtheria, tetanus, and pertussis, by about 73%, and similar rates of decline in HPV vaccination in teenagers. So there's this real concern that one of the collateral damage from this pandemic would be outbreaks of vaccine preventable diseases. A little word about children and youth with special healthcare needs. So this is within the subset of pediatrics, a particularly vulnerable group, as we know. They are at increased risk of complications from COVID because of underlying neuromuscular, cardiorespiratory, immune, so many other comorbidities. These are the patients that are likely to get most of their medical appointments through telehealth. These are the patients who normally require a lot of therapies, physical therapy, occupational therapy, speech therapy, and those are all hands-on activities. So disruption of that can really impact their health. Their home healthcare can be impacted. It is very critical for these families to keep adequate medications and DME supplies at home, G tubes, trach tubes, just other equipment, feeding tubes. And these are also patients who, as it is, have a higher, prevalence of mental health disturbances and behavioral issues. So those can be heightened, like anxiety and agitation. So with these families, they really need even more support than families with children who do not have any special healthcare needs. And I just referenced a resource for these families, which is called the Family to Family Health Information Center. This basically is a great resource for these families to connect with similar families, especially through times of stress. And again, reassuring these parents to really stay calm and be connected with them. In fact, at Metro Health, we have a really large division of pediatrics dedicated to the care of children with special needs that is called the Comprehensive Care Division. And a lot of what I have mentioned in this slide actually just comes from direct interviews with those physicians. Coming a little bit to projections, right? So again, I did start by saying that we do not know a lot. There is a lot of missing data on how common is COVID in children. I know we lack that data in adults too, but it's particularly awful in children. But there are some, predictive studies from the standpoint of, public health management and practice that have been done. This one came out recently, just about a week ago. Talking about the potential disease burden. And it is interesting that they have used these prediction models. They have done some really neat public health statistics, which is outside the scope of today's discussion, and talked about predicting the total number of children who will be infected with COVID with a cumulative infection prevalence of about 5%, which is about where we are, a little less than that. And so you can see within 2020, 3.7 million children would be infected with COVID. The number requiring hospitalization would be about 10,000, and the number requiring PICU stays would be about 1,000. And you can multiply all that 10 times for the 50% prediction model. So just to give some numbers, throw some numbers out there, since so much remains unknown about the extent of this virus in children. And this is our acute care capacity. It is a busy slide. I just want to direct your attention to the number of ICU beds that we have in the USA, which is about 5,000. And we saw, so definitely this just tells us about the gap that we have in case, unfortunately, if things get worse, there will be a lot of ramping up that would be needed in acute care capacity throughout the country. No talk about COVID in adults or children can be complete without talking about the public health impact of COVID, right? I mean, yes, we are all concerned about our practices. We are all concerned about what we are seeing day to day on the ground, but we really have to have an idea of how this affects the entire world. So the next few slides would be dedicated to the public health impact of COVID on children. This is just a picture of the widespread school closure that has happened all over the world and really thrown children off their normal schedules. So this slide, just basically, again, going into the details of the public health impact is outside the scope of today's presentation. So I tried to collate this into broader themes, which could be summarized as the direct health impact on children, which we talked about. Then the socioeconomic impact. More and more children who already live in poverty are going to be pushed further into poverty, into deeper levels of poverty because of their parents not being able to work and declining financial stability in the families. There is an exacerbation of learning crisis for our children. In the previous slide, and we are all experiencing it in reality, our children's learning opportunities, the normal school environment, everything has been snatched away from them. So there is a learning crisis exacerbation. There's a real concern for cyber safety now that more and more children are learning every day, every minute of the day online. Unfortunately, instances of child abuse, and mostly in disadvantaged families, children are vulnerable, easy targets of parental frustration or caregiver frustration has increased. There are increased rates of orphan registrations that are happening throughout the world. Hunger and malnutrition, right? Food insecurity. We have it locally, we have it globally, and we briefly talked about the concern for other infection outbreaks. So those would be some broader themes that I would really encourage all of us to think about beyond our clinics. So I know it sounds very depressing, right? It sounds like there is no hope and this is just all so awful, and what can we do as a person? What can we do as a community? But that's where faith and prayer steps in, right? And this is not unknown to even the leaders who claim to be invincible around the world. And so I just wanted to highlight this one particular initiative by UNICEF. This is the launch of the Global Multi-Religious Faith in Action COVID-19 initiative. And this is to basically use certain strategies like action, like faith, like using the religious and the faith-based platforms to disseminate public health information, social distancing information, offering support to vulnerable families, children, and youth. And so again, this is a huge initiative, and leaders from all over the world are joining hands to help their respective communities using their religion and faith platforms. Parenting during COVID, right? So after talking about this whole world and what's happening in the world, I will, in the last few slides, bring you back home. We are parents, we have children, we come back to children at home. And so what do we do for them? How do we talk to our children? What should we be careful about as we interact with them? Once again, these are just general principles. I know you all are excellent parents anyways, but for the sake of summarizing, remaining calming and reassuring, make yourself available to listen and talk to your children, provide them with honest and accurate information, limit their screen time that is focused on COVID. I think this is something that is just so omnipresent, like everywhere, no matter what screen you open, there's just breaking news about COVID everywhere. So, trying to pay some attention to what about COVID are they watching, and trying to redirect them to the more honest and accurate information about it, avoiding language that might blame or stigmatize others, and then just teaching them everyday habits to reduce the spread of germs, including social distancing, and reassuring them through this hard time that they are facing, where they can't just tap into their friends or access their friends, or are missing going to school, missing being with their friends, which we know is such an important part for adults, but especially also children. In continuation of that, recognizing your child's feelings, acknowledging their feelings, model how to manage feelings. It's okay to break down once in a while in front of your children. It's okay to tell them, what challenges you are facing as a person, and what tactics have you employed to try to bring yourself out of that emotional distress. Giving them hope, giving them some extra hugs, connect often with loved ones, your extended family, your friends. Maintain positive discipline. This is not a time to give up on discipline. You can't feel sorry for children in that way and let them just have their way. And then maintaining routines is important. I'm just highlighting this one resource, which actually was endorsed by the Director General of World Health Organization, just underscoring the importance of communicating with children during this time. I'm actually just going to read this quote by Dr. Tedros Adhanom Ghebreyesus. I hope I pronounced that correctly. It says, previous humanitarian emergencies have shown us how vital it is to address the fears and anxiety of young people when life as they know it gets turned upside down. And so he's endorsing a book, and I'll show you the cover picture of that book. We hope that this beautifully illustrated book, which takes children on a journey across time zones and continents, will help them to understand what they can do to stay positive and keep safe during the coronavirus outbreak. I actually accessed this book. It is freely available to be downloaded on the WHO website, and it's called My Hero Is You: How Kids Can Fight COVID-19. It is more suitable for the younger ones, but some of the older ones love to read it too. I know I loved reading it. And to conclude my presentation, this is what I have been telling my children every single day when we wake up and before going to sleep, that tough times don't last, tough people do. With that, I conclude my presentation, and I hope I was able to give you a little snapshot of what COVID-19 is for children, what it means, and I'm open for questions. Thank you very much for giving me this opportunity.